Last night, while you were sleeping, your brain was either recovering or quietly deteriorating. And the difference between those two outcomes had nothing to do with what you ate, nothing to do with how much you exercised, and your doctor has almost certainly never discussed it with you. It came down to one thing: the position your body was resting in. Here's the number that changes how most people think about their mornings. Stroke risk increases by 49% between 6 a.m. and noon. That is not a coincidence. That is a biological pattern directly linked to what your cardiovascular system was doing during the hours you were asleep. And for adults over 60, whose arterial walls have begun to stiffen and whose blood pressure regulation has become slower to respond at night, getting that overnight period right is no longer something you can afford to ignore. 6 sleeping mistakes are quietly raising your risk every single night. And the most dangerous ones are the habits you have had for decades. The ones that feel completely normal, even comfortable. If you often wake up with morning headaches, feel your heart beating harder than it should in the early hours, or simply never feel truly rested after 60, this video is for you. Welcome to the Stronger Seniors Podcast. I am Dr. Daniel Brooks. And joining me today is Dr. William Carter, one of the most trusted voices in senior cardiovascular and neurological health, with 33 years of clinical experience helping older adults understand exactly what their bodies need during those critical nighttime hours. Dr. Carter, I want to start with something most people have never once heard from their own physician. Why does sleep position matter so much after 60, and why is this conversation almost never happening inside a doctor's office?
That is exactly the right question to open with, Daniel. And the honest answer is that most physicians are focused on the conditions they can measure during a 15-minute appointment: blood pressure numbers, cholesterol levels, medication adjustments. Sleep position does not show up on a lab report, so it rarely gets discussed. But the research tells a very different story. What I have seen over 33 years of working with older patients is this: the body after 60 is fundamentally different from the body at 40. And those differences matter enormously during sleep. So, let me explain why. And once you understand the mechanism, everything else we discussed today will make complete sense. Here is what most people never consider, Daniel. When you are in your 30s, your blood vessels behave like new rubber tubing: flexible, responsive, forgiving. You could sleep curled up like a pretzel, and your cardiovascular system would quietly correct for it by morning. But after 60, that forgiveness disappears. The arterial walls begin to stiffen. The small vessels feeding your brain become less elastic, and your body's ability to regulate blood pressure during sleep, what doctors call overnight blood pressure dipping, slows down considerably. In a healthy sleeper, blood pressure naturally drops between 10 and 20% during sleep. That drop is not a side effect. That is your body doing its most important repair work. But when sleep position compresses the wrong vessels or restricts airflow in the wrong way, that protective dip gets disrupted. And what fills that gap overnight is cardiovascular stress your body was never meant to handle for 7 or 8 hours straight.
Dr. Carter, you mentioned that stroke risk actually peaks in the morning hours. Most people assume the danger is highest during physical exertion or stress during the day. Can you explain why that early morning window is so critical, and what exactly is happening inside the body during that time?
This surprises almost every patient I share it with. The morning surge in stroke risk, that 49% increase between 6 a.m. and noon, is driven by a natural spike in blood pressure that occurs as the body transitions from sleep to wakefulness. Cortisol rises, heart rate accelerates, and blood pressure climbs sharply within the first 30 to 60 minutes after waking. Now, in a younger body with flexible arteries, that morning surge is handled without incident. But in an older body where the arteries have lost elasticity and where overnight blood pressure dipping may already have been disrupted by poor sleep position, that morning surge lands on a cardiovascular system that has been under quiet stress all night. That combination is precisely what makes the early morning hours the most vulnerable window of the entire day.
So, essentially, what happens during those sleeping hours is setting up either a safe morning or a dangerous one. Dr. Carter, I have to ask, because I know our viewers are already wondering. You mentioned 6 specific sleeping mistakes that most people are making right now without realizing it. And I heard you tell a colleague recently that one of these mistakes is actually recommended by some health websites. Which one is that, and why is the advice so dangerously wrong?
I am glad you asked that, Daniel, because this particular mistake is one I see constantly, and it genuinely frustrates me. People follow advice they found online, they believe they are doing the right thing, and they have absolutely no idea what it is quietly doing to the pressure inside their skull every single night. And I will tell you exactly what it is. But first, I want our viewers to understand one thing. These 6 mistakes range from surprisingly harmful to genuinely dangerous, and the further down the list we go, the more serious the consequences become. So let us start at the beginning.
You mentioned the first mistake is one that health websites actually recommend. Most people assume sleeping completely flat is ideal for spinal alignment. Why is that advice working against your brain after 60?
This one genuinely surprises people because it sounds so reasonable on the surface. When you lie completely flat, particularly after 60, cerebrospinal fluid, the liquid that cushions your brain inside your skull, loses the assistance of gravity to drain properly. It begins to pool. Intracranial pressure edges upward. And your brain, which is already managing years of subtle wear on its smallest vessels, is now sitting under slightly elevated pressure for 7 or 8 hours straight. A study published in the Journal of Clinical Sleep Medicine found that even modest head elevation of as little as 15 degrees led to measurable improvements in intracranial pressure and nighttime blood flow dynamics. Now here is the symptom most people completely misread. You wake up around 3:15 in the morning with a dull, throbbing headache, maybe behind the eyes, maybe at the base of the skull. You assume it is just aging. You drink some water and go back to sleep. But what if that headache is your brain signaling that the pressure inside has been too high for hours? The fix is not complicated. A 15-degree elevation of your upper body is often all it takes. And I will explain exactly how to achieve that safely when we get to our solutions.
Dr. Carter, you mentioned stomach sleeping next, and I know millions of people swear by it for comfort. But you told me once that what stomach sleeping does to 2 specific arteries in the neck is something most people would never connect to stroke risk. What exactly is happening there?
When you sleep on your stomach, you physically cannot breathe face down into the mattress. So you rotate your head to one side, typically the same side every single night, because we are creatures of habit. Now think about what that means structurally. Your neck is rotated up to 90 degrees for 7, 8, sometimes 9 hours per night. Running along both sides of your cervical spine are 2 vessels called the vertebral arteries. These carry blood directly to your brainstem, your cerebellum, and the regions responsible for balance, breathing regulation, and coordination. When the neck is significantly rotated for prolonged periods, these arteries can become kinked. Think of it exactly like stepping on a garden hose. The flow does not stop completely, but it becomes restricted. And restricted blood flow to your brainstem for 8 hours, night after night, year after year, is not something the body simply shrugs off. Research published in the Journal of Manipulative and Physiological Therapeutics confirmed that extreme cervical rotation measurably reduces vertebral artery blood flow velocity. I have had patients tell me they have slept on their stomach for 40 years and feel fine. And I always say the same thing. You feel fine until the morning you do not. I do not say that to frighten anyone. I say it because the timeline on this kind of damage is slow, quiet, and completely preventable.
Dr. Carter, most people think their pillow choice is just about neck comfort. But you mentioned that the wrong pillow is quietly doing something dangerous to the veins that drain blood away from the brain. What is actually happening? And what did you see in one patient that made this impossible to ignore?
Most people choose their pillow based on how comfortable it feels in the first 5 minutes. But here is what they are not thinking about. Running along each side of your neck are the jugular veins. Think of them as the brain's drainage highway, carrying blood away from the skull and back toward the heart. When a pillow is too high and pushes the chin down toward the chest, those veins become partially compressed. Drainage slows. Pressure inside the skull builds quietly over hours. I had a patient, a gentleman named Harold, 76 years old, a retired engineer from Indiana, sharp man. He had been sleeping propped up on 3 pillows for years because of acid reflux. He started noticing he was forgetting words mid-sentence. His family was convinced it was early dementia. When I evaluated him and we discussed his sleep setup in detail, I asked him to try a single contoured wedge pillow that elevated his entire upper body at the correct angle rather than just pushing his head forward. Within 3 weeks, His wife called my office and said the word-finding problems had nearly disappeared. His brain had simply been partially drained of proper circulation every single night, and nobody had connected it to his pillows. A study published in Clinical Neurophysiology in 2019 confirmed that jugular venous compression during sleep is significantly associated with increased intracranial pressure and impaired cerebral drainage, particularly in adults over 65.
That story about Harold is remarkable. Now, here's something that confuses a lot of people. Many viewers have heard that side sleeping is better than back sleeping. But you told me that the side you choose actually makes an enormous difference, and that millions of people are sleeping on the wrong side, believing it is protective. Which side is the dangerous one, and why?
This is the counterintuitive one that stops people cold in my office. Many people sleep on their right side because it feels natural, or because someone told them it is good for digestion. And I understand the logic. But here is what that position is doing structurally. Running along the right side of your spinal column is a large vein called the inferior vena cava. This is the primary vessel that returns blood from your lower body back to the heart. When you lie on your right side, body weight compresses that vein. Blood return from the lower body slows. Your heart has to work harder to compensate. Over a full night of sleep, that added cardiac workload is not trivial, especially in a heart that is already managing the natural changes that come with age. Now, I always get a laugh when I tell patients this in clinic. I say, if you have been sleeping on your right side your whole life thinking you are doing your heart a favor, I have some mildly inconvenient news for you tonight. But the good news is, the fix is simple, and we will get to that very soon.
Dr. Carter, you mentioned that mistake number 5 involves something that disrupts a cleaning system inside the brain that most people have never even heard of. A system that, when it stops working properly, may actually accelerate memory loss over time. What is that system, and how does sleep position affect it?
This is the one that genuinely changes how people think about sleep forever. About a decade ago, neuroscientists identified what they now call the glymphatic system. Think of it as the brain's overnight janitorial crew. While you are in deep sleep, cerebrospinal fluid pulses rhythmically through the spaces between brain cells, flushing out metabolic waste products that accumulate during the day. And the most important of those waste products are amyloid beta and tau proteins, the exact proteins found in excessive quantities in the brains of Alzheimer's patients. Now here is the critical part. This glymphatic clearance only happens efficiently during deep, uninterrupted sleep. When people shift positions constantly throughout the night, those position changes trigger brief microarousals, tiny interruptions in deep sleep that most people never consciously notice. But the glymphatic system notices every single one. The flushing cycle gets interrupted. Waste accumulates. A landmark study published in the Journal of Neuroscience found that glymphatic clearance is significantly more efficient during side sleeping than any other position. And this is not just about how you feel tomorrow morning. This is about whether your brain is adequately clearing the waste that, over years and decades, may accumulate into cognitive decline. That is a sentence I want every viewer to sit with for a moment.
Now, mistake number 6 is one I suspect most viewers will recognize immediately, because it describes a perfectly normal evening for millions of Americans over 60. And yet what it does to blood pressure and cardiovascular stability overnight is something most people would never guess. What is happening inside the body after a late dinner and a glass of wine before bed?
Picture this: dinner at around 7:30, a glass of wine while watching television, in bed by 10. That sounds like a completely reasonable, even pleasant evening, and it is, in many ways. But here is what is happening inside the body while you sleep, after that scenario. After a large meal, significant blood volume is redirected from the brain and heart toward the digestive system. In a younger body, that redistribution is managed seamlessly. In an older body with less arterial elasticity and a slower autonomic nervous system, this shift can create brief drops in cerebral blood flow during the night. Now add alcohol. Alcohol is a vasodilator. It relaxes and widens blood vessels, causing blood pressure to drop. The body senses this and compensates by constricting vessels and raising pressure again. Blood pressure oscillates up and down throughout the night. And in vessels that are already dealing with some degree of stiffness or age-related fragility, that oscillation places stress on arterial walls. The American Journal of Hypertension studied this exact pattern and found that even moderate alcohol consumption within 3 hours of sleep disrupted the natural overnight blood pressure dipping that healthy sleepers depend on. Without that dip, cardiovascular strain during the night increases meaningfully. You might recognize this scenario. You wake at around 2:15 in the morning, heart beating harder than it should, slightly warm, slightly disoriented. You tell yourself it was just a vivid dream. But what you experienced may have been your vascular system working hard to stabilize a pressure fluctuation it was not well equipped to handle quietly. The recommendation is simple. Finish eating at least 3 hours before bed. If you drink alcohol, stop at least 4 hours before sleep, and take a 15-minute gentle walk after dinner. Not exercise, just movement. That single habit begins digestion, stabilizes blood sugar, and gives your cardiovascular system a chance to settle before you go horizontal.
Dr. Carter, we have covered 6 mistakes that millions of people are making every night. Now I want to get to what everyone watching has been waiting for. You said there are 2 specific sleep positions that research actually supports for protecting the brain and heart after 60. What is the first one, and why does the science behind it go far beyond simple circulation?
The first position is left side sleeping. And I want to be very direct about this because the evidence is unusually strong. When you sleep on your left side, several things happen simultaneously that work in your favor. First, the inferior vena cava, that large vein we discussed on the right side of the spine, is completely uncompressed. Blood returns freely from the lower body to the heart. Your heart works less. Circulation stabilizes naturally throughout the night. But here is the discovery that truly changed how sleep researchers think about position, and this connects directly to everything we discussed about the glymphatic system. A landmark study published in the Journal of Neuroscience found that side sleeping, and particularly left side sleeping, optimizes the geometry of glymphatic fluid flow through the brain. The cerebrospinal fluid moves more efficiently, clearing amyloid beta and tau proteins more completely. Left side sleeping is not just about tonight's circulation. It is about whether your brain is adequately clearing the waste that, over decades, can accumulate into the very cognitive decline that most of us fear most. That connection between a simple sleep position and long-term brain health is one of the most significant findings in sleep medicine in the past 20 years. If you have never been a side sleeper, use a full-length body pillow along your front to prevent rolling backward. Place a pillow between your knees to keep your spine neutral. Give it 7 nights. Your body adapts faster than you expect.
That glymphatic connection is genuinely remarkable. Now, for viewers who have shoulder arthritis, joint pain, or simply decades of back sleeping habit, what is the second position that offers real cardiovascular and neurological protection without requiring side sleeping?
The second position is back sleeping with upper body elevation between 15 and 30 degrees. And I want to emphasize this clearly. Stacking 3 pillows under your head does not achieve this. That just pushes your chin toward your chest and creates the jugular compression problem we discussed earlier. What you need is the entire upper torso. An adjustable bed frame works even better. What does this elevation achieve? It uses gravity to assist blood return from the lower body. It reduces the cerebrospinal fluid pooling effect that flat back sleeping creates. It keeps the airway more open, which improves oxygen delivery throughout the night. And if you add a small pillow under your knees to maintain the natural lumbar curve, you achieve what sleep researchers call a zero-gravity posture, where pressure is distributed evenly across the entire body, minimizing strain on any single vessel or joint. This position is particularly beneficial if you experience mild sleep apnea, frequent morning headaches, or have been told your blood pressure remains elevated even while you are asleep. One more practical note. Keep your bedroom between 65 and 68 degrees Fahrenheit. A cooler room helps your core temperature drop naturally, which triggers deeper, more restorative sleep and lowers nighttime blood pressure. And consider keeping a small overnight pulse oximeter on your nightstand. If your oxygen level regularly drops below 92% during sleep, that is a conversation you need to have with your physician. It could point to sleep apnea or early circulation issues that are quietly compounding your cardiovascular risk every single night. Daniel, before we close today, I want to say something directly to everyone watching. Your risk of stroke does not clock out when you fall asleep. In many ways, the hours between midnight and dawn are the most critical hours for your brain and cardiovascular system in the entire day. And what we have covered today, 6 specific mistakes and 2 evidence-backed solutions, these are things you have direct, immediate, zero-cost control over starting tonight. Let me recap briefly. Sleeping completely flat elevates intracranial pressure. Stomach sleeping kinks the vertebral arteries. The wrong pillow compresses the jugular veins. Right side sleeping strains the heart through the inferior vena cava. Constant position shifting disrupts the brain's glymphatic cleaning cycle. And late eating combined with alcohol destabilizes cardiovascular pressure throughout the night. The 2 positions that research supports are left side sleeping, which simultaneously protects circulation and optimizes brain waste clearance, and elevated back sleeping between 15 and 30 degrees for those who cannot tolerate side sleeping. Pick one thing from today. Just one. Try your left side tonight. Elevate your upper body 15 degrees. Stop eating 3 hours before bed. Any single one of these, done consistently night after night, is not a small adjustment. It is a nightly investment in the health of your brain and your heart that compounds over weeks, months, and years.
Dr. Carter, as always, this conversation has been genuinely eye-opening. The connection between sleep position and long-term brain health is something I think every single person over 60 deserves to understand. If today's conversation gave you something useful, something your last doctor's appointment never covered, I would love for you to hit the like button right now. It genuinely helps more people find this information when they need it most. Drop a comment below and tell us, are you a back sleeper, a side sleeper, or a stomach sleeper? We read every single comment, and your answer might help someone else in this community recognize a pattern they have been living with for years. Share this video with someone you care about, a spouse, a sibling, a close friend over 60 who keeps waking up with unexplained morning headaches. You might be giving them something their doctor never has. And if you want to keep protecting your brain and your heart with conversations like this one, subscribe to the Stronger Seniors podcast and hit that notification bell so you never miss what we cover next. We are honored to walk this health journey alongside you. This channel is for educational purposes only and is not a substitute for professional medical advice. Always consult your healthcare provider before making health-related decisions. We will see you in the next episode. Now, before we say goodbye, here is something I love doing at the end of every episode. A quick health knowledge challenge to keep your mind sharp, engaged, and curious, because staying mentally active is one of the best things you can do for your brain after 60. Here is today's question. We talked about the glymphatic system, the brain's overnight cleaning crew. Based on everything Dr. Carter shared today, which sleep position has been shown by research to make the glymphatic system work most efficiently? And what are the 2 specific proteins it helps clear from the brain that are directly linked to Alzheimer's disease? Drop your answer in the comments below. There are no wrong answers here, only a community of people who are learning and growing together. I will be reading every response.